Hi everyone, it's been a busy day here at Community Pharmacy Scotland today, certainly with the funding announcement and the associated implications at this late stage for Easter holidays. We had hoped to bring Martin along for one of the videos tonight, but unfortunately that's not been technically possible, so Harry is going to give you an update on that in just a second. So we're going to dip between myself, as it was my turn to do the video tonight, and Harry as the most senior member of the executive to deliver the important message around and some context around funding and Easter and why it was announced today, etc., and the potential implications for you. Just one brief point on the videos just before I do move to Harry, and then I'll come back briefly after with a few additional points. The videos are under review. As an executive, we have looked, even every Monday, we review what we're doing, how we're doing it, and if we're doing it well. The videos are intended to be a benefit to you guys out in the network and our members. So we take the feedback that we've had around the videos on board. It's been largely positive, but we realise they will serve a purpose for just a certain amount of time. So we may be looking in the near future to scale back or indeed stop the messages. Not that we don't enjoy speaking to you guys, we clearly do, but it's got to be right, and it's got to be with a purpose and with added value, as we've always said. So we will take any feedback on board and look at that appropriately in review. We have our Community Pharmacy Scotland board meeting tomorrow. This is happening through Microsoft Teams tomorrow for the first time, so that should be an interesting experience. Our board have been cited on major decisions and proposals as and when and whenever possible. So, but it will be great to get the board together, get their views on everything that's going on at the minute, and strategically we will be looking alongside them to get their steer on where we should be going and what we should be focusing on the immediate future in and around the COVID pandemic situation. So I'll pass over to Harry, and I'll be back after Harry's message around funding and Easter. So see you shortly, guys.
Thanks, Matt. Hello, colleagues. You will no doubt have seen or heard the announcement from Jean Freeman regarding finance and Easter opening during the First Minister's briefing at lunchtime today. First of all, an apology. Despite my best efforts, many of you heard this for the first time on television, and that is not appropriate. Our internal processes will be reviewed and steps taken to attempt to remedy them. I turn first to the finance that she mentioned. This is a first initial payment, and it's secured at the level of £5.58 million and not the £5.3 million announced. The key word here is initial, and it forms part of a larger request submitted to the Scottish Government. This funding is for reasonable adjustments you have made to your premises and increased staff costs during March. CPS, we also appreciate this may not be enough to cover these costs, and links to a return for additional funding for Easter bank holiday openings, which I will now turn to. As Matt and I have tried to highlight over the past week, this request could come, and to be clear, the expectation is that not everyone will have to open these holidays. The objective is to give pharmaceutical care coverage across health board areas, and I know some health boards have already started to communicate potential numbers to you. The ask is therefore for you to consider where you can help with this, and as the advice is for people not to travel, if at all possible, consider whether you could open even for a half day on Good Friday and or Easter Monday. The Cabinet Secretary was very clear today that the Scottish Government will meet in full any necessary costs incurred by community pharmacies in supporting the NHS at this time. The level of funding for this activity is one of the major points for decision at the CPS board meeting tomorrow, and your elected representatives are aware of the salary implications on bank holidays. Now, I fully appreciate how difficult an ask this is at such a late stage and after the last 3 weeks that you and your teams have been through. Many of your teams are extremely tired, and therefore the ask is to open where it is possible to do so during an exceptional period for the NHS in Scotland. I anticipate being able to send the communication to you all tomorrow following the CPS board meeting on remuneration rates. Thank you for listening tonight, and I'll hand you back to Matt.
Hi everyone, back again. So thanks to Harry for that part of the video. Now, just some positive news around PPE for the network. The guidance, you'll be aware, was changed last Thursday evening, and the wheels have been turning, and Harry certainly gave you an update on a number of meetings that have been going on to ensure that this gets out to you as soon as possible. I've had some discussions today with colleagues from Alliance Healthcare who will be distributing the PPE again, and colleagues from Scottish Government to say that this should be with pharmacy in terms of the masks, which are the new evidence-based requirements for pharmacy, because mainly that's based on this lack of potential social distancing that can happen in pharmacies, so that it is recommended that masks be used if you can't guarantee a 2 metre social distancing. So yes, the masks will be distributed, so it will be in two boxes. So it'll be an initial allocation of 2 times 50 masks, so 100 masks essentially to the network, and that should be out by the end of the week. So that's really good news actually. I was quite not concerned, but you know, things take their time to turn around, particularly when it's the whole NHS that we have to consider as part of this. But no, the pharmacy requirements have been met and actioned relatively quickly, and we're been told that they should be out by the end of the week, so that's great. They are for sessional use. Now, a lot of people asking what is sessional use. It is essentially, in a pharmacy context, it's a shift, or for example up to lunchtime, and if you're going to have your lunch, then you change it after that. So it can be for a shift. So if you work in a Saturday morning, for example, it would be for that 4-hour time period, unless of course you get it wet or it's damaged in any way. That's mainly because we're not in close proximity and dealing directly in operation terms and in terms of clinical assessment with COVID patients, or we certainly shouldn't be, although I am still aware, even from practice, that some members of the public don't always take that message. But we're not directly in the face of these patients. So sessional use, generally for pharmacy, means a shift, which in many practical senses means a number of hours until you take your first break, or if the mask for some reason gets compromised. So that's that in terms of PPE. So I think that's quite positive news. We have Adam confirmed now for Facebook Live on Thursday evening. It's another Ask Me Anything event. That will be at 8 o'clock. So Adam fronts up these very well, and he'll be delivering that on Thursday again. So if you've got any questions around anything, certainly again ask Adam that. I'm afraid there's no shout outs tonight, guys. That's not because no one is deserving of it. We have so many people that are deserving of it, and the shout outs may well come back, but nothing tonight. We just thought, get the messages across tonight, deliver the messages as required, and we will be back tomorrow, certainly after our board meeting, and we can give you an update on anything that requires updating, if and when required. Anyway, keep it going, guys. Thanks very much again, and all the best. Bye.